Who is it?
It's Darius, your nurse, your student nurse.
Okay, you can come in.
Hey, good morning. My name is Darius, and I'll be your student nurse today. And I've been sitting in to give a respiratory assessment, a cardiac assessment, a musculoskeletal assessment, and a pain assessment. Is that okay with you?
Yes.
All right. Well, first, before I begin, can we get your name and your date of birth?
Alice Smith, 4/4/1976.
76. All right. And you know who the president happened to be?
Yes.
Can you tell me his name?
President Trump.
Trump. All right, thank you so much. I'm gonna wash my hands. Simulate my hand washing and provide privacy for the patient. All right, Ms. Smith. Before we begin with your respiratory assessment, I'd like to ask you, are you experiencing any pain today?
Yes.
And by what would you rate your pain?
About 3.
3. Where is pain located?
I have a headache.
A headache. About how long do your headaches last when you have them?
About an hour.
And do you remember when you started having these headaches?
This morning.
You remember what you were doing when you had these headaches?
I was sweeping the floor.
Sweeping. All right. Put that in my chart. All right. So for your respiratory assessment, I'm going to assess your respiratory rate and your breathing effort. I'm going to auscultate, let's listen to some of your breathing sounds, and I'm going to give you some quick education on some breathing techniques to help with your breathing and to help eject sputum if you haven't produced any. Are you producing any sputum?
No.
All right. So begin with, listen to the 4 points on your back and 4 points on your chest area, and I'll listen to 2 points on your side. Is that okay?
Yes.
All right. Thank you. And when I tell you to, just breathe in as much as you can and slowly exhale, okay?
Okay.
Deep breath. Deep breath. Deep breath. Deep breath. Let me get one over here. Thank you. Deep breath. All right. So far, everything sounding good. Good expansion. All right, deep breath. Deep breath. Deep breath. Deep breath. I'm going on this side. A deep breath. Okay, good. Everything's all good. Seems like you breathe with normal effort. No labor breathing. All right. So I'm going to educate you on this. It's called the incentive spirometry. It has a tube connected to it. And you breathe into the tube. You put the tube in your mouth and you breathe in as deep as you can. It's for helping to strengthen your lungs, reduces the potential of you getting pneumonia, and just a general exercise. It's kind of like lifting weights, but for your lungs. Okay, give you that.
Okay.
And then I'm gonna instruct you on what's called the turn and cough technique. Is when you turn your head and breathe in as deep as you can, and you forcefully cough. This is you to eject any type of sputum or any type of substance you have in your throat, just in case you might be having trouble breathing. You aren't producing any sputum, right?
No.
All right. That's it for that. This we're going to go to the cardiac assessment. Before we go to, have you had any trouble breathing in the last, let's say, a week or so?
No.
Okay, great. All right. On the cardiac assessment, first I want to ask, have you had any chest pain recently?
No.
Okay, good. So I'm going to inspect your jugular vein. Inspect for distension and make sure you're not having any sort of heart issues. So, if you don't mind, could you turn your head to the right and I'm going to shine this pin light. See. All right, okay, good. It could be a sign of heart failure or fluid retention if your jugular vein is bulging out the side of your neck. All right, now I'm going to palpate some of your pulses. It's going to be your wrist or your radial, your posterior tibial, which is behind your knee, and your dorsalis pedis is on top of your foot. Are you okay with that?
Yes.
Okay. All right, can I see your right hand? Thank you. Put about a 80 for your pulse, your radial pulse anyways. A strong bounding pulse, I'll give you a +3 on that one. All right. I'm gonna check your posterior tibial. Let's see. If you don't mind, I'm gonna roll your pants leg up real quick.
Okay.
Go a little further. All right. I'm gonna check your, excuse me. Had a little lunch while I came in. I'm gonna check your dorsalis pedis on top of your foot. All right, I'll give you about a +2 on both of those.
Okay.
Let's see, +2. All right, well, I'm headed. I'm gonna check your limbs for edema and check your capillary refill. Okay?
Yes.
Hold up over your arms for me. All right, put your hand on your knees. Your refill is great. Circulation is great. All right, I'm gonna check your foot if you don't mind. Check your refill down here. Damn good so far. It's wonderful.
Okay.
I'm gonna see if you got any edema on calves. No, you do not. Take the other one. All right. Yeah, I'll check this out. Okay, and now I'm gonna get auscultate some of your heart sounds. I'm gonna listen to your heart sounds to your chest. I'm gonna listen to your aortic area, your pulmonary area, Erb's point, tricuspid area, and the metro area. Is that okay?
Yes.
Excuse me. If you don't mind, can you lift your breast so I can let's see your other area down here?
Pretend like.
All right. Everything all good. No murmurs. It was exactly what we was hoping for. All right. And also I have to do a head and face, ears, eyes, nose, and throat assessment. But first I'm going to do your musculoskeletal assessment. Have you had any numbness or tingling in your hands recently?
No.
All right, good. I'm going to show you and I'm going to perform them on you. For your wrist, you have 3 motions. One's called flexion. Is when you tuck your wrist in towards your body. Extension, that's your normal position. And hyperextension, that's when you kind of bend your wrist back. Okay? I'll show you. You bend down. All right. Got good motion. All right, for your fingers, we're gonna do flexion, extension, hyperextension, abduction, and adduction. I'm just gonna perform them on you.
Okay.
Flexion, you're gonna tuck your thumb in, kind of put your fingers together like you're about making a fist, and that's what you call flexion. Extension is when you extend your fingers all the way out like normally, and hyperextension is when you kind of bend them up. I don't want to bend them up too bad. I don't want to hurt you any. See, abduction, is when you spread your fingers out, kind of like an exercise, kind of like doing ab exercises. And adduction is when you put your fingers back together. You can say you're adding them together. And I'm going to do it for your thumb too. For your thumb, flexion will be tucking your thumb in towards the palm. Extension is your neutral position for your thumb, and hyperextension is away from your hand. And also with your thumb, they have what's called opposition, is when you touch each one of your fingertips with your thumb like this. So far you have good range of motion in your hands. That's great. All right, I'm gonna do assessment for your foot. Is that okay?
Mm-hmm.
Now for your foot, we have what's called inversion. That's when you point your toes inward towards your body like this. And then we have eversion, is when you point your foot outwards, kind of like doing a little dance. And then you have dorsiflexion. I shortened it. Well, I didn't. I said it right. Cool. Sometimes I get my words mixed up. Dorsiflexion is when you point your foot upwards, and just your foot in general, not your toes. They got another term for that. And plantar flexion is when you bend your foot downward. Then we have the hyperextension of your toes. That's when you just bend your toes upward. And then you have the flexion of your toes. It's when you kind of tuck your toes in. Like when you step on a Lego and your foot starts hurting. And so far, your range of motion has been on point. I was glad to see that. Also, Just real quick, I want to see how you walk and how you stand. If you have good balance, and make sure you don't have any shuffling gait. Is that okay?
Mm-hmm.
All right. I'm gonna take your hand and help you stand up. Are you ready?
Mm-hmm.
All right. And if you could, can you walk maybe right here to this corner and back? All right. Good. Good. Thank you. All right. So now I'm gonna do a quick assessment on your head, ears, eyes, nose, and your throat. So the first thing I want to do is ask you, have you had any well, actually you have had a headache. You did. You told me earlier that was a 3 for that pain. Outside of that headache, have you had a history of headache? Have you? So
No.
just that isolated incident.
Mm-hmm.
All right, good. Come on. Look at your face. Make sure both sides of your face look even. Mm-hmm. No type of bulging, bruises. Nothing abnormal. All right. All right, we're gonna go on to your ears. Have you had any ringing sounds in your ears lately? Any hard of hearing?
No.
All right, good. No. Use the light and look into your ear real quick. Everything looks about equal. I'm gonna perform what's called a whisper test. I'm gonna lean back real quick. I'm gonna whisper something to you, and I'm gonna give you like a 4-digit number, and you say it back to me. Make sure you can hear me, okay?
Okay.
All right, you ready?
Mm-hmm.
All right. 0, 1, 2, 3.
0, 1, 2, 3.
All right, good, good. Patient hearing is good. Ears are symmetrical. All right. For your eyes, have you had any vision problems recently?
No.
Do you wear any glasses or contacts?
Reading glasses.
Reading glasses? Okay, let me. All right. I'm gonna check your pupils for dilation and contraction to make sure they're equal. Because once you shine a light in one side, they're both supposed to dilate, or excuse me, they're both supposed to contract from the bright light. So you know you don't want to have too much light in your eyes and cause damage to your eyes. But we have a problem if one side contracts and the other side stays normal. So I just want to check that out real quick. All right, you ready?
Mm-hmm.
All right. Seems pretty good. And also I'm going to just check to see if both your eyes can focus on an object coming close to you at the same time. I'm going to put this pin light slowly. I'm going to bring it close to your face, and I'm going to be looking at your eyes, okay?
Okay.
All right, good. And symmetrical on your eyes. And I'm going to move on to your nose. Have you had any problem breathing through your nose?
No.
Have you had any problem smelling any scents or smells?
No.
All right, cool. No COVID. All right, let's see. Can I look at your nose?
Mm-hmm.
Symmetrical on both sides, no bruising. All right. And I'm gonna shine my light up your nose to see what's going on, okay?
Okay.
See bruising or bleeding. Good. And I'm going going to your throat and your neck. We're almost done, okay? Have you had any difficulty swallowing lately? Or eating?
Mm-mm.
Okay, good. I'm just gonna ask you to open your mouth as wide as you possibly can. I'm gonna be looking at your tongue, your gums, and your teeth to make sure nothing is abnormal, okay?
Okay.
Hey, Rick, you say ah? I'm gonna pull you. See a nice lid, look at your gum. All right, everything's okay. Your teeth are okay, gums are okay, speech is okay, and you can swallow. Thank you so much, Miss Smith. You've been a wonderful patient for me. I'm gonna get this in my chart and I'm gonna see if we can get you anything for pain. I'm gonna leave you with this call light. Here you go.
Okay.
If you need anything in the meantime, you let me know, okay?
Okay.
All right, thank you.